Vaccines, understanding the risks and benefits. Vaccines have long been presented as one of the greatest achievements in public health, credited with eradicating diseases like smallpox and polio. However, discussions around vaccine safety, effectiveness, and potential side effects have grown over time, leading to debates among medical professionals, researchers, and the public. As new vaccines continue to be introduced, it's crucial to examine what's in them, how they work, and whether they carry risks that outweigh the benefits. Understanding the science behind vaccines can help individuals make informed choices about their health. Were infectious diseases declining before vaccines? Many people believe that vaccines were the primary reason for the decline of major infectious diseases like measles, polio, and smallpox. However, historical data shows that these diseases were already in significant decline before vaccines were introduced. This reduction was largely due to improved public sanitation, cleaner water, and better waste management, better nutrition, helping the immune system fight infections naturally, enhanced medical care, early detection and treatment. For example, death rates from measles dropped by 90% between 1912 and 1960 before the measles vaccine was introduced. Similar declines were observed for diseases like cholera, tuberculosis, and typhoid fever, which were never fully eradicated by vaccines but instead reduced by improved living conditions. The role of natural immunity. The human body is designed to develop long-term immunity after recovering from an infection. This is why many childhood illnesses, like chickenpox, provide lifelong protection once the immune system has fought them off. However, vaccine-induced immunity works differently. While natural immunity often lasts a lifetime, vaccine immunity can wear off over time, requiring booster shots. In some cases, this creates an unusual risk. After vaccination, some people may still get the disease, but in a more severe form because their immune system did not fully develop long-term protection. What's inside a vaccine? Vaccines contain a mixture of ingredients, including killed or weakened viruses, to trigger an immune response. Aluminum compounds used to stimulate stronger immune reactions. Preservatives like thimerosal, which contains mercury, used to prevent contamination. Formaldehyde, a chemical used to inactivate viruses and bacteria. Many of these ingredients raise concerns due to their potential effects on the nervous system and immune function. For example, thimerosal, ethylmercury, was widely used in vaccines until concerns arose about its impact on brain development, particularly in infants. While some vaccines have removed thimerosal, others still contain trace amounts. Aluminum-based adjuvants are included to boost the immune response, but studies have linked high aluminum exposure to autoimmune diseases and neurological issues. The flu vaccine. Does it really work? Every year, flu vaccines are widely promoted, yet studies show that they may not be as effective as advertised. In children under 2 years old, flu vaccines offer no significant protection compared to a placebo. In adults over 65, studies have shown no clear reduction in deaths or hospitalizations from flu-related complications. In many flu seasons, the vaccine is ineffective against the dominant flu strain, leading to false confidence in protection while exposing people to potential side effects. Ironically, some studies suggest that getting flu shots every year might weaken long-term immune defenses, making people more vulnerable to future flu infections. Vaccine safety concerns. While many vaccines are credited with preventing diseases, they also carry documented risks that are often downplayed in public discussions. Contaminants in vaccines. Some vaccines have been found to contain unexpected viruses, bacteria, and DNA fragments from animal or human cells. These contaminants can potentially alter immune responses and, in some cases, increase the risk of chronic conditions. For example, the polio vaccine in the 1950s and 60s was later found to be contaminated with SV40, a monkey virus linked to cancer. This discovery raised concerns about long-term vaccine safety and the presence of unknown contaminants in modern vaccines. Autoimmune reactions. Many vaccines contain aluminum adjuvants, which overstimulate the immune system to create a stronger response. However, some research suggests that this may increase the risk of autoimmune diseases like rheumatoid arthritis, multiple sclerosis, lupus, type 1 diabetes. These reactions occur when the immune system mistakenly attacks the body's own cells, mistaking them for invaders. Vaccine-induced illness. Some live virus vaccines, such as the oral polio vaccine, have actually caused outbreaks of paralytic polio, particularly in countries where the vaccine is still used. Similarly, studies have found that some flu vaccines may increase the risk of getting severe flu infections in later seasons. Pregnancy and vaccination a risky combination? One of the most controversial recommendations is the practice of giving flu and Tdap vaccines to pregnant women. Research shows that women who received flu vaccines during pregnancy had a 400% higher risk of miscarriage. Immune stimulation during pregnancy can impact fetal brain development, increasing the risk of autism, schizophrenia, and learning disorders in children. Despite these concerns, vaccine recommendations during pregnancy have increased, raising questions about long-term effects on infant health. Natural ways to strengthen immunity. Instead of relying solely on vaccines, a well-nourished immune system provides strong natural protection against infections. Research highlights key nutrients and habits that improve immune resilience. Essential nutrients for immune strength. Vitamin D3, found in sunlight, egg yolks, and fatty fish, helps regulate immune responses. Vitamin C, found in citrus fruits, bell peppers, and strawberries, supports the body's ability to fight infections. Zinc, found in pumpkin seeds, beef, and lentils, helps immune cells function properly. Selenium, found in Brazil, nuts, and seafood, supports antiviral defenses. Gut health and immunity. Since 80% of the immune system is in the gut, a healthy digestive system is key to fighting infections. Adding probiotics from fermented foods like yogurt, sauerkraut, and kimchi can help build natural immunity. Herbal and natural immune boosters. Elderberry, shown to reduce the severity of flu symptoms and shorten recovery time. Garlic has natural antibacterial and antiviral properties. Green tea contains antioxidants that help fight infections. Final thoughts: making informed choices. Vaccines are often presented as the only way to prevent disease, but research shows that public health, nutrition, and natural immunity play an even bigger role. While vaccines have benefits, their risks and long-term effects should be openly discussed. Ultimately, health decisions should be made with full transparency, informed consent, and respect for individual choice. This podcast is for informational purposes only and should not be considered medical advice. Always consult with a qualified healthcare professional before making any decisions about your health, vaccinations, or treatments. The information shared is based on available research and discussions within the medical and scientific community. We encourage you to explore multiple sources and make informed choices that align with your well-being. References and further reading. For those interested in diving deeper into the science behind vaccines, immunity, and health, Centers for Disease Control and Prevention, CDC, Vaccine Safety, National Institutes of Health, NIH, Immunity and Infection Research, Environmental Working Group, EWG, Toxins and Heavy Metals in Food and Water, PubMed Central, PMC, Peer-Reviewed Vaccine Studies, World Health Organization, WHO, Global Vaccine Reports. These sources provide a range of perspectives and scientific findings for a well-rounded understanding of the topic, yet are not an exhaustive list.